Hi, good day. I'm Dr. Kiran Maharaj.
I'm Indy.
Nice to meet you. I've been instructed here today to perform an examination of your knee joint. Would that be okay?
Yeah.
Are you any pain and discomfort right now?
No.
If at any point in time you feel any pain and discomfort, would you please let me know?
Yes.
Do you notice in your daily activities, things like going up the stairs or performing a squat to pick up something, you notice any pain and discomfort?
No.
Okay. First, let's begin with general inspection. So I'm going to look anteriorly, look at the alignment in knee and ankles. Looking for any varus or valgus deformity, looking for any hyperextension, and looking for any deformities on the posterior. Okay. Now I'm going to do some functional testing. So what I'm going to ask you to do is to perform a squat for me, as low as you can go, and then come back up. So looking at the quality of movement and if you have any pain or discomfort.
Okay.
Do you have any?
No.
I'm going to ask you to squat on one leg for me, please. Back up, right, to look balanced, symmetrical, right, movement, and no compensation movement. You can also ask you to hop on one leg, or if you're involved in things like doing lunges or any sport specific activity, I can ask you to perform those to see how we recreate the pain. I'm going to ask you to walk to the door, please. And looking at the cadence, looking at any arthritic gait or any compensations. Put one foot in front of the other, heel and toe, and walk back. Okay, great, so no issues. Can I ask you to go to the bed, please?
Sure.
On close inspection, I'm looking at the muscle bulk, the quadriceps, looking for any atrophy and the scars, bruising, which I don't see any. We're focusing on the right knee for now, but ideally clinically we'll compare it to the left knee. Right, so I was going to palpate, feel for any warmth, erythema. Now I'm going to feel for any effusions, patella tap, and then for any small effusions, I can patella sweep. Which I don't see any. Going to palpate now, just going to feel quadriceps, tendon here, coming back down, patella tendon, tibia tuberosity, going around medially, medial joint line, medial collateral, coming back around, lateral joint line, and lateral collateral. What do you feel around patella? And I'm going to move the patella left and right, feel any crepitus. Any pain or discomfort so far?
No.
Okay. I'm going to feel behind your knee, any swelling in Baker's fist. Any pain or discomfort? Huh?
No.
Great. Now we can move on to some movement exercises now. What you're going to do now is going to ask you to kick out, so extend your knee, pull it back in. One more time. Come back in. Great. I'm going to ask you to as well to lift your knee straight up, come back down. So this is a good test to see how well the quadriceps and patella is functioning. Right, so I'm going to move your knee now, so don't help me. So I feel any end-to-end movement, feel any crepitus, any discomfort, movement, which is fine. Okay. What we're going to do now is go on to some special tests.
Okay.
So we're going to do for the anterior collateral ligament now. So this is Latchman's test. So at 30 degrees, I'm going to pull anteriorly. So I'm looking at end-to-end movement, see if there's any laxity here. I don't feel any. I'm going to sit on your feet now.
Okay.
With anterior draw. Similar looking for any laxity. I don't feel any. I could also do the pivot shift test, but that is normally done under anesthesia, right? Because it recreates the dislocation. Posterior collateral ligament now. I'm going to push down. Similarly fine. No pain, discomfort.
No.
Okay. Now we're going to do the posterior sag side. What you're going to do is pull this to me, this one. And I'm looking for any the tibia withdrawn. So let's see any of that. So it's negative. Now we're going to move on to medial collateral and lateral collateral ligament. So So what I'm going to do is stabilize here and here, and I'm going to provide a valgus here. Any pain?
No.
And then the other way?
No.
No? Okay. Now we're going to test for the meniscus. First what we're going to do is the McMurray, sorry. So what we're going to do is at 30 degrees, I'm going to externally rotate varus here, the medial meniscus, and then repeat internal outward varus instead of a valgus, right? Motion. What I'm going to ask you to do now is to perform Tessalis for the meniscus test. I'm ask you to do. So what you're going to do is balance on one foot at 20 degrees bend, and I will help you. You're going to go internal and external rotation. Any pain or discomfort?
No.
I'm ask you to go back on bed. Next one I'm going to perform is the patellofemoral joint, and the patellofemoral apprehension test. So what I'm going to do now is let's have your knee bend at 30 degrees. I'm going to laterally displace and see if your patella is lax or discomfort you're feeling. No?
No.
Next one I'm going to do is patella grind. What you're going to do is contract the quadricep for me. I'm going to pass it down with pressure. If you find any crepitous, any pain?
No.
Okay. Right now, we'll test for neurological function. So we did extension, which is L3, L4, and then flexion, when you flex the knee this way, that was L3, L4, and this is L5, S1. So what we can do is to press on it was on my feet, right, and then back up, press up, up. Let's complete the biotomes, and I'm going to touch you with this to feel soft. Close your eyes and tell me every time I touch you with this. So going through
Yes.
the tomes, and I can compare on both sides.
Yes. Yes. Yes.
And toes.
Yes. Yes.
I'm going to test your reflexes too as well. To complete the exam. And compare to the other side. Anything? And the other side of the ankle. Okay. Right. Did you bring your shoes today?
Yes, I did.
So I'll look at your shoes, look at the wear pattern, supination, overpronation, any braces or orthotics.
No.
I'll have a look at that too as well to see the wear pattern and fit too as well. So this brings me to the end of my examination. Do you have any questions?
No.
So I'll put everything together and we come up with our management plan from there.
All right. Thank you.